Shot, and welcome to Deuk Spine Institute. We are live streaming spine surgery. Our patient has several causes of lower back pain, specifically facet joints, SI joint, which is the sacroiliac joint, and the piriformis muscle. We're going to be treating all three today. We'll start with the facet joints. The first live stream will be the Deuk plasma rhizotomy to treat facet joint pain on the left side. You can see she has scoliosis. We're going to make a 4mm incision. We're going to go down with our Deuk plasma wand and deaden the pain nerves to those joints. Those are the L34, L45, L5S1 facet joints. Henry, let's show the audience, how do facet joints cause so much pain?
Copy that.
And welcome back. You can see from our animation, when the facet joint is injured, it can actually cause severe pain through inflammation. And what we're trying to do is go in and eliminate the pain by eliminating the pain nerves, essentially. Pain nerves are called the medial branch of the dorsal ramus. Everybody has pain nerves to the facet joints. And you can see we are just about in the right spot at L3. Would you agree, Jordan? Sean? Yes, sir. Show us the pedicle of L3. There you go. Very good. I'm actually on the TP right now, Sean. That is the perfect place to deaden the pain nerve, right where the probe tip is. So that'll be our first burning of the pain nerve, and what I can feel is really a lot of arthritis. Shot. Remember, she has bad scoliosis, so her spine is quite twisted. But there's one nerve down, and a few more to go. If you have questions, feel free to ask them. Otherwise, Henry, would you mind showing our audience how this Deuk plasma rhizotomy works? Shot.
Of course.
Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
You can see from our animation what's needed to be done in a rhizotomy. We are actually destroying pain nerves that innervate the facet joints that are full of arthritis and causing horrific pain for the patient. So to destroy these pain nerves, we have to go to their location. And then the traditional treatment has always been, for rhizotomy, has always been to use what's called RFA. Unfortunately, RFA doesn't work. It doesn't last when it does work. If you get relief from an RFA, it's always temporary. Well, patients don't want temporary relief, they want permanent relief. So we developed at Deuk Spine a new technology to do a rhizotomy. Same goal as an RFA shot, but instead of RFA, which fails at destroying the pain nerves, RFA does not perform the rhizotomy. It doesn't do it properly. This procedure does. The good news is it's outpatient and it's highly effective. And usually patients get it done one time and then that's it. We're done, right? So that's our goal with her, is to do this procedure and be done with it. Shot. And we have questions, so let's take a question from our audience. Shot.
This question coming from George on YouTube.
Hi, George. Welcome to our live stream.
Asking, how do you treat central stenosis?
Great question, George. So central stenosis is narrowing of the center of the spine. And I treat it by doing, if you need, well, first of all, George, let's talk about why would you need treatment for central stenosis. Is central stenosis ever happen and you don't need treatment? Yes, all the time. Lots of people have central stenosis and they don't need treatment. We're done with our Deuk plasma rhizotomy. L34, L45, L5S1. We're going to end the stream in a moment and we're going to resume with our SI joint DPR for sacroiliitis. But to answer your question, if your central stenosis needs treatment, and the only reason to treat central stenosis is myelopathy, and that's usually in the neck or thoracic spine, then I would treat it with the endoscopic procedure called the Deuk laser disc repair. All right, let's end our live stream and come back, and let's show the audience first. The entire surgery was done with this 4mm incision. Okay? You guys see that?
Yes, we do.
One incision, 4mm, like this is the blood loss. It's probably half a drop. And we destroyed 4 nerves at L3, L4, L5, S1. And those nerves are the ones that bring all the pain signals up to the brain. Let's show that video one more time, Henry, so the audience can understand it. But we're going to put a staple, and we're going to move on to the SI joint.
Copy that.
Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-69.
And welcome to Deuk Spine Institute. I'm Dr. Deuk Majan. And you can see from the x-ray, we are treating the left sacroiliac joint today. My pointer is just passing through the middle of the joint. Our patient presents to us with sacroiliac joint pain and discomfort. People with SI joint pain and discomfort, you can do a variety of treatments, but unfortunately they don't work and they don't last. Those treatments include injections of the SI joint, or you can also do stem cells, PRP, And some doctors these days actually recommend fusing the joint. The fusion of the joint is a very invasive procedure, very painful shot. And in my experience, I think it doesn't work at least 50% of the time. They just came out with a study in Europe that shows fusing the SI joint is no better than not fusing it. So they're saying that fusions don't work in Europe. All right, Jordan, where do you think the foramen is posteriorly? I think it's medial. Yeah, that's what I'm thinking. Sorry. So we're going to go in and deaden the pain nerves to the SI joint. And to do that, I'm using a probe. I'm in the deepest part of the joint right now. This is the fibrous part of the joint. Shot. Let's see where this is. All right. Shot. Uh-huh. I'm just trying to get myself situated to where the best location to zap these pain nerves is. Shot. If you have questions, feel free to ask them. I'll do my best to answer them for you. This fibrous part of the joint is the deepest part of the joint. Shot. You actually have to go through a few ligaments to get there. Shot. These ligaments hold the joint together, and I'm passing through them to get deeper to where the pain nerves are. They're buried underneath the ligament, unfortunately, at the top of the SI joint. Shot. And then at the bottom of the SI joint, they're more superficial, closer to the surface, which is nice. Okay, just about done here. Any questions?
At this moment, no current questions.
Shot. You can see the iliac bone. You can see we're just lateral to the foramen. Let's hope that does it. All right, let's go ahead and end our broadcast. We've just completed the SI joint treatment. We'll give a little medicine to reduce the amount of swelling and inflammation. You can see the incision is 4 millimeters. So we did her facet joints earlier, 3, 4, 4, 5, 5, 1, left side. Now we did the left SI joint. Go ahead. And finally, we're going to come back. We have one more pain source to do, and that's the piriformis muscle. So join us in just a few minutes for the next broadcast for a left piriformis muscle release. And welcome to our live stream of spine surgery here at Deuk Spine Institute. This patient came to us with 3 different causes of back pain: facet joints, sacroiliac joint, piriformis muscle. How do you know if you have pain from a piriformis muscle? The butt crack is here, okay, it ends there, and the hip is over here. The piriformis muscle pain, if you put your finger right between the butt crack and the side of the hip, that's where the piriformis muscle tears are most common. They could be cheating a little bit to the medial side, a little to the lateral side. But people with piriformis syndrome, they have a tear in the muscle. They basically overstretch, bending, twisting. It rips the muscle in half, And once they get that tear, they get all this inflammation and pain and tenderness in their buttock. And it's a pain in the butt, literally. So how do you best treat this? We've tried shots, we've tried therapy, we've tried pills. Nothing gives lasting relief except one treatment, and that is to cut the muscle. When you cut the muscle, you can cut it here in the middle. It requires a big incision like this, and that's what most orthopedic surgeons will do if they treat this. Not all of them do, about 10% do. And it's a huge incision, and they got to cut through your gluteus maximus. So I pioneered a brand new way to fix this. We've actually applied for a patent for it because nobody's ever thought of it. But it's a tiny little incision here, and I just go in and release the muscle tendon off the hip. It's very safe. There's no blood vessels in this area. There's no nerves in this area. You've got the sciatic nerve right here. And so, you know, the surgeons that do the traditional piriformis release are at risk of injuring the sciatic nerve. Where we are, we're not. Come on in with the x-ray. We're going to get started. We don't have any animations to show you, but just bear along with us as we release this piriformis muscle and treat her piriformis syndrome permanently. Shot. All right, there it is, the top of the hip. You can see it. Num num. We call it the greater trochanter. And that's where we're going to be releasing this muscle, right off the top of that hip. Any questions, feel free to ask. I'll take those questions from you.
At this moment, no current questions.
All right, let's get started. This is an outpatient procedure. So if you know somebody who's had buttock pain for years, this is the treatment to get rid of it. It's only done at Deuk Spine Institute, and we pioneered it right here. Shot. All right, so I'm just lateral to the trochanter. Now I'm on the trochanter. Hold on. I'm literally feeling it with my probe. So I'm on the back side. It's called the posterior facet. So I got news for y'all, Shot. This procedure and this problem, piriformis syndrome, is the second most common cause of sciatic pain. And what does that mean? Well, it means pain down your leg. The most common cause is a pinched nerve in your back. The second most common cause is the pinched sciatic nerve in your buttock. And we're going to be unpinching the sciatic nerve with this procedure. Okay? All right, hold on a second. All of this is done percutaneously. Shot. You can see the probe is on the medial surface of the trochanter. You can hear the fibers of the muscle being released. It's amazing. You hear that?
Yes, we can. Yeah.
That's not me snapping my fingers. That's me releasing the piriformis.
Wow.
That's about as high as you want to go. You can kind of see the shadow of the muscle right there. Show us the shadow, Jordan. That's correct. That's the top border. And there's the bottom border. And it runs over and attaches right to your tailbone. Pretty incredible procedure. And there's no bleeding. And honest to God, every time we do it, we've had 100% relief. And that's it. And it's outpatient. Now, if you do this surgery the traditional way, before you do it the Deuk Spine way, the traditional way, these patients are laid up in the hospital for days. I'm just going to put a little medicine there to help ease the discomfort from the procedure, because it's painful. This is a painful procedure. All right, let me close it up. And I'm going to show you folks, we do all this with just a little staple and a Band-Aid. And that's it. Any questions? 4 millimeter, 4 millimeter, 4 millimeter.
At the
You're
moment,
watching the future of spine surgery right here at Deuk Spine Institute, treating all 99% of chronic back pain with our treatments. 99% can be cured with these treatments. Go ahead, Henry.
at this moment, no current questions.
All right, I hope you enjoyed our live stream today. We have one more surgery, I believe. No? Never mind. We're done. I think this is it. We're done for today. We'll be back on Thursday. Thanks for joining us. You've just watched the left piriformis release.